labs. Um, on certain child visits, you absolutely need to use the macros for child physical exams, and they're here at the top. Now you can scroll down and see that there are lots of different macros for lots of different conditions. I use macros a lot for eczema visits because it automatically brings up some useful PDF files to print out. I use it for otitis media, colds, things that you do a lot of visits for. It's helpful because it keeps you from typing in the same plan over and over and over again in the free form. It just allows you to click. If there's something that shows up that you don't like, you can stop it. You can delete it. Now, I don't use the hypertension one very much. You'll notice that this patient happens to have hypertension up here because it's got a lot of tests on there that you don't typically run or things that you do. That you don't always do on every visit. Looks like they may have changed that a little bit, but used to it showed a lot of stuff like renal ultrasound and things like that, which you're not just going to be doing every time. But some of these adult type things can be helpful also. And sometimes if you don't know what the workup is for a certain diagnosis, you can look on the macro and you can learn a little bit about that. Now, if you want to restrict your macros to a certain suite, you can do that here also. So you want to make sure that your macros are usually on family medicine unless you're in the peds department. Now let me just uncheck this hypertension. Where did it go? Well, might as well just show you how to delete things anyways. I can select everything by checking the checkbox and just click delete and they'll go away. Now keep in mind that none of these orders are going to actually be processed until I click the save button. Now macros are not the only way to order things. If you want to order a lab, you go to the lab, you select the diagnosis that you want to order the lab under, and you can choose what you want to order. Now this tab here allows you to select the full list of all labs, and then top picks, it will show you a list of the top labs that are ordered for that diagnosis. So if he had another diagnosis here besides hypertension and I changed it, these top picks list, it would change and show me some labs that were more specific to that diagnosis. And that's true for any selection that you choose up here. Clinic labs are labs that you order that the patient doesn't have to go to the lab for. They're things that the nurse can do. You can see that see what we've got there. Nursing button is for other things that the nurse does besides collecting labs. So if you want to order a ace bandage or something like that, anything that you want the nurse to do that's not a lab, an injection or a vaccine is under here. Immunizations you order here, although typically you're ordering immunizations under the macro for that child's age. But if they're behind on their shots, or you don't want to, and you only want to order one certain thing, it's helpful to come in here and order that. Injections are for drug injections as opposed to vaccine injections. The RAD button is for radiology. That's for and any X-ray that needs to be done in our clinic. If it's something like a CT or anything that we don't do in our clinic, it's OPRAD or outpatient radiology, and so you can see that this is an entirely different list, stuff that we can't do in our clinic. Procedure, this is one way to have a note reflect a procedure that you've done and also allow you to bill it, although I've never done it before, so you'll have to learn how to do that from someone else. REF is referral, if you need to refer to the patient to somebody. If you can't find the specific thing that entity that you need to refer your patient to, you can always just select other doctor to find and select that order before you save it, click edit, and then under the internal memo field you just type who it is you want to refer them to. So I'll say refer to GI, and then you click update just for that change to apply, and then I would click save if I were done. Schedule is a follow-up order. If you don't want to type it in to your note, you can click to order it, and also what that does is allows the secretary to see when you want them to follow up when they come back out and to the front desk after the visit and say the doc told me to follow up, but he didn't say when. Specialty RX. This is a way to order things like crutches, um, lift chairs, things like that that they would take to a medical supply store or a drugstore to get. If you go in here and order a specialty RX, then if you go in the main MedInformatix program afterwards and go to this print specialty RX, then the name of that thing that you ordered will already be stuck right in there. And EDU is a way for you to document educational things that you went over with the patient, counseling type stuff. I don't use it very much because the alphabetization of the items is not very intuitive. So you wind up using pretty much all these buttons from time to time. Just keep in mind that when you do order something, whatever is in this box here at that time that you have selected is what diagnosis gets associated with that order. And so you want to make sure that whenever you do click on something, it's checkbox, that you have the appropriate diagnosis in that box. Now, it has to be an active diagnosis from that day, or else it won't show up in this list. So before you load the ordering program, make sure that you've got all your diagnoses in your main MedInformatix window activated. And so here we've only got hypertension. If we add diabetes, and I go back to the ordering program, you can see that diabetes is not going to show up, because anytime you're allowed to switch back and forth between the two, but just because you add a diagnosis here doesn't mean that it gets sent over to the ordering program. You have to reload the ordering program in order to get the new diagnosis to show up. So now you see there it is. So keep that in mind also. When you do get ready to click save on an order, let's just order something random, the ordering program will go away and you'll take you back to MedInformatix, but the ordering program will still be open. If you look down here at the task bar, you can see that the ordering program here, mouse, comma, Goofy, that's the ordering program button. It's still active, and you could bring it back up and click settings and click exit and make it go away for good. But if you do that, then the next time you try to open the ordering program, whether it be this patient or another, it's going to ask you to put in all that information again, who you are, what suite you're in, who the attending is, this stuff here. And so it's better in any given clinic to just leave the ordering program open at all times. Don't ever go to that file settings exit until you're done for the day. And when you close one patient's chart and open another, and then you click on ordering program, it automatically changes to that patient's name. And so you don't have to close it to come off Goofy Mouse and to get on to Billy Mouse. It'll do that for you automatically if you access it from that patient's chart. Okay, let's get back into the ordering program here. There are other things that you can do with the ordering program. You can build the actual E&M billing for the visit. You can add diagnoses, but I never do those things from within the ordering program. You can get somebody else to show you how to do it. Now, let's say you've got the ordering program open and you need to change some of that information, like who you are, who the attending is. You can go to Edit and go to Provider, and you can select Billing Actual or RX. It doesn't matter. And it'll bring that field up and you can change that stuff. You don't have to close the ordering program and reopen it in order to change that stuff. So that's a brief overview of how to use the ordering program. It's actually doing a lot of changing right now. There are new features that are being added that's kind of beyond the scope of this tutorial. Hi, in this lesson of the MedInformatix tutorial, we're going to go over the prescription writer and how to use it and what kind of information you can get from it. We're looking at patient's chart, fake patient Mickey Mouse, and at any point while this chart is open, you should be able to click on this RX button.